And good afternoon, everyone. Thanks so much for joining us for this Thursday's COVID-19 press briefing. Today, Mayor Demings will begin with some encouraging news on international travel. There is also much new news on vaccines for children. The mayor will discuss what that means for Orange County, at least in broad terms for now. The mayor will also provide an update on positivity rates, the I Got My Shot campaign locations, and COVID-19 testing locations as well. We will receive updates on other topics such as emergency rental assistance and redistricting. Dr. Raul Pino with the Florida Department of Health in Orange County will report on important COVID-19 trending data here in Orange County. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here today. This is the 166th news conference that we have held since we started briefing you on our collective efforts to respond to the novel coronavirus, COVID-19. I'll share with you today, good news. Some of you may not think it's good news, but this will be the final routine briefing that we will do for COVID-19 in this community. If things change in the future and the virus reignites itself, then perhaps we would make some modifications, but we will not schedule press briefings in advance. So as we start today after nearly 19 months of doing this, we have a lot of good news that we will share today with you. First, I'd like to start by talking about lifting of the international travel ban here within the United States. The ban will end in just a couple of days on November the 8th. Orange County hasn't seen as many overseas visitors as we normally would see since March of 2020. But earlier this week, I participated in a panel discussion on the reopening of the U.S. borders for inbound international travel and what this means specifically for British tourists coming to Central Florida. The Orlando region is expected to get as much as $765 million worth of UK business in 2022. I told the UK leaders that we are perfectly prepared to handle all of the Brits who will be coming to visit with us. Our convention center has been accredited by the Global Biorisk Advisory Council STAR accreditation regarding its safety protocols. 76% of our eligible county residents are now vaccinated. That puts us in a very good position here locally. And our entire tourism community is excited to re-engage with the UK and rightfully reclaim our title as the #1 tourism destination in the world. Isn't that good news? There's more good news this week regarding vaccines. The COVID-19 vaccine has finally been approved for children between the ages of 5 to 11 years old. On Tuesday of this week, the CDC made the final approval for the Pfizer vaccine for young children. The 2-dose series has a 3-week waiting period between shots, which means millions of children could be fully vaccinated for the upcoming holiday season. Dr. Pino will have more information on this exciting news, and we do have Mr. Scott Howard with us today from the Orange County Public Schools, who will share information on their vaccine distribution plans. We are also in discussions here internally within Orange County to see what we can do to complement the efforts of the school district and other efforts here locally to ensure that our children, our young children, have access. We're working on plans to offer the children's vaccine at Barnett Park, and we hope to share details with you very soon on how to make an appointment and when it will be available. Now, I'll talk about the latest numbers. There are now 233,010 coronavirus cases reported in Orange County. We've come a long way in terms of the numbers since the very first press briefing, in which we had 0 cases. So now 233,000+ cases. All of those represent individuals and families. And the number of Orange County residents who have died from COVID-19 has now reached 2,230. That is an additional 52 fatalities since we met last week. Our hearts continue to go out to the families of all of those who unfortunately have died of the novel coronavirus, COVID-19. As I mentioned, 76% of Orange County residents have received 1 or more doses of the vaccine, and 66% of our residents have completed the full series. And the 14-day rolling positivity rate continues to go in the right direction. As of today, the rate is now 3.15%. This is extremely good news for our area. Remember, the pinnacle for us was to have sustained transmissions below 5%. And now for certainly better than 20 days now, we have seen that number come in on a daily basis below the 5%. Back on September the 13th, at our 155th news conference, the 14-day rate was 13.3%. Again, we've come a long way, now down to essentially 3%. I believe that we're in a good place because even when we do our wastewater plant monitoring and the research that is being done with that, our utilities team are closely monitoring the 3 water plants here in Orange County, and they report there have been no findings of the mu or the lambda variants in our water. So, in terms of the vaccine trailer, we continue to reach out into our community. Even though we're at 76%, we can get that number up even higher. The I Got My Shot vaccine trailer continues to go into the local communities to get our residents vaccinated. The vaccine available the vaccine trailer will be available for residents 12 and older. Today, the trailer can be seen at 6:30 p.m. until 6:30 p.m. at the John H. Jackson Neighborhood Center on Carter Street in the Paramore area. Tomorrow, Friday, it will be at the Mexican Consulate in Orlando between the hours of 9 a.m. to noon. Saturday, it will be at the Mount Zion AME Church in Oakland between the hours of 11 a.m. and 1 p.m. The Pfizer, Moderna, and Johnson & Johnson brands are all available. You can get information at ocfl.net/IGotMyShot. Testing continues at Barnett Park 7 days a week between the hours of 9 a.m. and 5 p.m. You can get information at ocfl.net/testing. Again, if you need rental assistance, there's help for you available. The program that is funded from federal relief dollars offers up to $30,000 worth of rental assistance and now may cover up to 3 months of future rent payments instead of 1 month. This means eligible residents can receive up to 12 months of assistance with past due rent and up to 3 months of future rent assistance, totaling up to $30,000 in emergency rental assistance. To date, our Orange County staff has assisted over 2,100 families in being able to stay in their homes and avoid eviction. More than $12.3 million has been approved for distribution to keep Central Florida families in their homes. I will point out that 225 of those families have received more than $10,000 in assistance. For more information, you can go to ocfl.net/rental assistance. I want to talk about our redistricting efforts here within Orange County. We've had great participation as we have moved meetings around the county recently. This coming week, District 2 will host the redistricting meetings at the Wekiva High School in the gymnasium on Monday evening at 6:30 p.m. For more information, you can go to ocfl.net/redistricting. And before I turn it over to Dr. Pino, I'd like to mention that this evening, right here, tonight we will be celebrating Diwali, the Festival of Lights, outside our county administration building. Diwali is recognized by millions around the globe. Our beautiful celebration here is a collaboration with the India Center at the University of Central Florida, the Asian Cultural Association, Fusion Fest, and the Orange County Asian Committee. It will be broadcast at 6 p.m. on Orange TV. And so with that, I'm going to turn it over to Dr. Pino.
Good afternoon, Mayor. And before I start, I would like to thank you for your leadership and partnership in fighting this pandemic, and the Florida Department of Health in Orange County have a better partner than you. Thank you. For the update, the mayor mentioned to you that we have reached 233,010 individuals positive for COVID-19, and our 14-day average rate has stay about 3.1. That is for the 14-day, the 7-day, and also for the daily average rate that we measure. Unfortunately, the number of days has reached 2,230, and that's an additional 52 deaths. Not a number that we would like to see, but I will explain what is in that number. And the range was 27 to 95. The median age, 67, that median age continued to drop. So it's important for people of all ages to get vaccinated. Our condolences, of course, to families and friends, not only of these recently reported death, but everyone that has succumbed to this disease. 25 female, 27 male, 2 Asian, 15 black, 28 white, 7 or other race. Ethnicity, 15 Hispanic, 37 non-Hispanic. 21 had unknown conditions, 31 we don't know yet. Now for the numbers, 3 are from July of this year, reviewed by the state and reassigned to Orange County. 1 of the deaths was from August, 11 are from September, and 37 are from the month of October. 5 of the 52 deaths, or 9.6%, occur in people with addresses in long-term care facilities. Of 8 of the 52, that is 50.4, were fully vaccinated with COVID-19 vaccines, with a median age of 82 for those who were fully vaccinated and succumbed to the disease, and the median time between serious completion and a positive lab result was 168, or about 6 months. 6 of the 52, 11.5, were partially vaccinated with 1 dose of the 2-dose series. 1 was past due their 2nd dose, and 5 were not past due the dose. With regard to the death, just to give you total numbers, although we reported 52, we have not recorded any in November yet. That doesn't mean that it's not going to happen, but we have not. The month of October is down to 64 from 304 in the month of September, from 411 in the month of August, which was the highest ever during the pandemic. The CDC continues to have our county in orange, which is from 50 to 99 individuals per 100,000. We are at 54, So it will be just a matter of time before we go on yellow, which is also good news. The mayor did mention to you about the vaccines. I want to give a little bit more information. But before I do, I want to focus in a group of individuals that have not received their second dose and are out of the window of the, for 28 days or 21 days for the second dose, depending on the doses. For the total population, it is about 114,000 people that have not received their second dose, or at least we don't have a record that they have. They could have received the second dose in another state, and we will not have a way to know that right now, but it will not be 114,000 people that did that. And that is about 7.8% of the total population of our county. From 12 to 17, we have about 15,000 people that that out of the second dose window. And for people of 65 years and age, it's actually the group performing better. It's only about 11,000 people. Now, for those who have missed their second dose or the time frame, you don't need to restart. You can go and get your second dose at any time. My advice to you is please go and do it. Your immunization levels will not be at the levels that need to if you don't have that second dose. For completion, this means people either receive Johnson & Johnson or receive the 2 completed doses. We have completed 800,018,425 individuals have received complete vaccines in our county, and that is 65.75% of that population, of our target population. Now, for residents 12 to 17, the completion is at 54.8, and for residents over 65, our completion is actually quite good. It's at 79.4. That means 79.4 of all residents above 65 in our county are fully vaccinated. For at least 1 dose, for all residents, we are 74%. For 12 to 17, we are 69.2%. And for residents 65 and plus, we are at 85%. With regard to students, 5 to 11, Orange County is ready to take on this challenge. It's going to take different shapes and forms, and Scott Howard from the school will go more into details, but we have worked with a third-party provider that the state, the Department of Health, will pay for all the doses and vaccines that will be provided in our schools. So we will be able to provide vaccines in schools. When are we getting the vaccines? So different providers will get different vaccines on different dates. We, meaning the health department for the immunization clinic, is getting 5,000 doses, and that should be on Monday or Tuesday. We already got the auxiliary, the syringes, the gloves, and everything that comes with it. We should get the vaccines either Monday or Tuesday, and that's going to be 5,000. Now, that is 5,000 for the clinic. The county is going to get much more. We also work with the state to use the same provider at the disposal of the county to be able to do vaccination events out in the community. And those are the events that the mayor spoke to you about. Now, another feature is that vaccines are widely distributed in our county. We have it in pharmacies, all the pharmacies, some of the supermarkets, as you know, but also your provider, your pediatrician will be able to order the vaccine and to provide it to your child if you have healthcare coverage for your children with providers. So we have tried to make it as easy as possible for parents to have access to the vaccine. Like the adult vaccine, it's going to be a little bit slower in the beginning, although we are much better prepared, and then it's going to take off from there as we start receiving vaccines. Scott, would you like to explain?
Dr. Pino, thank you, and thank you for your partnership in making this happen. We are prepared for our 5 to 11-year-old vaccination rollouts in the schools. Orange County Public Schools next week has 4 dates identified. It's November 9th, 10th, 11th, and 13th. We will provide vaccination events at each of our 22 high schools over that time period, be about 6 or so a day. They will serve our feeder patterns for the schools that feed those high schools. So right now, we're in the process of communicating to all of our parents of our 5 to 11-year-olds in those elementary and middle schools, letting them know that next week, when and where they can get their shots in arms and take their children to do that. So that's being rolled out now. We did a district-wide message to all of our parents yesterday, and each of the principals at those schools will be giving individual messaging, letting their parents know where they can go. Those shots will be after school. It is voluntary. I want to make sure that's emphasized, that getting these shots, the coronavirus COVID-19 shots, is completely voluntary. We are strongly encouraging our parents to take advantage of this opportunity. Again, 22 high schools, 4 days, from 4 to 8 on those days. The information is on our website. You can go to ocps.net and go to COVID-19 information, and the vaccine information will be there. And all of the schools that'll be offering the vaccines, along with the feeder pattern schools that will be able to go there to get the vaccination. One point, if a parent can't make it to a specific school that's their feeder pattern, they can go to one of the other schools. They can go anywhere within the school district to access the COVID-19 shot. We certainly appreciate Dr. Pino and his partnership, and our third-party Health Hero that's helping us do this. They've been working with us on vaccinations prior when we were doing 12 to 17-year-olds at our schools, so they're very familiar with the process, and we hope there'll be a strong demand for those shots, and we'll continue to do what we can to make sure that parents have it available for their children if they want it. So we thank you, and Mayor, thank you for your leadership and providing this platform for the school district, for OCPS, for me to be able to get out this information on behalf of our superintendent, Dr. Barbara Jenkins, and our school board, and we really appreciate the opportunity, and I'm happy to answer any questions later about distribution. Thank you.
Yeah, since Scott is here, why don't you all, if you have any questions of the school district, you can go ahead and ask them. If we need to translate in Spanish, we do have Ms. Ilia Torres, who's here to be able to translate. All right, Scott, look like you got it.
Maybe I answered them all.
Hello, this is Alibet with Noticias Telemundo Orlando. I just want to go in detail with the distribution of the vaccine and what is so important that kids get vaccinated through the schools.
Doctor, you want to talk about the importance of the vaccination? I can
Yeah,
talk about the.
sure. So what are we doing this, and what we are doing so intensively like this? It has been designed this way on purpose, because we want to vaccinate the largest number possible for children before the holidays. This is all mapped out in a way that when they go home, many of them will have already the second dose for the holidays, including Christmas when it comes. So what we are trying to do is to preemptively protect the students to that larger time out in the community with family members, party and going to eat and visiting outside the state, all the goodies that come with the holidays. So we insist to parents, it's very important to sign your consent form, to sign it on time, to send it back to the school, to listen to the messages, and to get your kids vaccinated before they go into the break. Because what we would like to see is at least 50% of the students protected when they come back to school in January.
That,
En español. Claro, mira, la importancia de esto es que lo hemos diseñado de esta manera para que todos los estudiantes, o la gran mayoría de ellos, estén vacunados antes que se vayan al receso escolar. Viene Thanksgiving y viene también Navidad. Entonces lo que queremos es que todos los niños, la mayor número posible, pueda tener la segunda dosis antes de Navidad, para que cuando regresen en enero estemos todos vacunados y el ambiente sea mucho más seguro para ellos y para la comunidad.
I would only add that the way the schedule is set up and the way the aggressive nature, we will be able to get first and second doses by Thanksgiving. 2 weeks after that will be anyone who would have taken part in those two vaccination events would be fully vaccinated before the winter break, and that's really our goal.
Lauren Seabrook, Channel 9. Dr. Pino, my question's for you. We've heard from some parents who say they were pretty anxious to get their child vaccinated when the numbers were really high, but now they see the numbers coming down and they start to think the pandemic is nearly over. And when it comes to their kids, they're in a position where they are trying to, balance if this is the right choice, and they're not so sure anymore because the numbers have come down so much. So what could you say to them?
Listen, every decision for healthcare is a decision of the parent. I will advise that they consult with the provider, the pediatrician, if they have one. But the reality is that, and we hope that it remains this way, and I think it's going to remain around this way, but we have been here before, and it has gone bad before. It doesn't mean that it's going to, but you have to prepare in case of. And it takes about 2 weeks after the second dose to be fully immunized. So this is a preemptive approach for protection and prevention. It's not about curing, or it's prevention. And prevention you have to do in advance if it doesn't work the other way. So if someone is going to wait for the pandemic to go bad again to get vaccinated, they are waiting for their own reason, because they are increasing the risk of getting infected.
Hey, Dr. Pino, it's Samantha with Fox 35. So I have a question about vaccine distribution. Does the state allocate certain vaccines for children? Because we have seen claims of parents having to cancel appointments because their pharmacy does not have the vaccine for children, saying that the state didn't order any vaccine for children. Do you have any insight into that?
No, the state, they order vaccine for children because we are getting vaccines. But providers can order directly now. It's not all through the state. Providers do have access to the Florida shots. That's the system that the state has in place for immunizations. They do know how to do it. They have ordered in the past. They should continue to order. But the reality is, as I mentioned before, the distribution, this vaccine was approved 2 days ago. Although it has been in production, you cannot ship a vaccine to providers before it gets approved. So now that it's approved, all that distribution is happening, and within a week, we should be inundated with vaccines.
Okay, so if there are no other questions for the school district, then we'll open it up. But I do want to point out that we have others here. We have our Director of Public Safety, Danny Banks, who has joined us, Dr. Yolanda Martinez with Orange County Health Services. We also have Ricardo Day from our HR here with Orange County. We have Commissioner Myra Uribe and Commissioner Gomez Cordero, who have joined us as well. And so if there are other questions, I just wanted to make certain that you realize who else was in the audience. And so we will move forward. Again, if there is a need for translation in Spanish, we'll use Ms. Ilia Torres to do that at this time.
Okay. My name is Anika. I'm from WESH. I had a question for Mayor Demings. I wanted to ask about the ruling from OSHA today and Governor DeSantis's response to it, saying that he would like to file suit. Could you tell me a little bit about what your response is to that and what you think it'll look like here in Orange County around January 4th?
I am not aware of whatever comments Governor DeSantis made or what the CDC says, so it would be a little premature for me to comment on it without knowing specifically what they said. Right?
Okay. This is Melissa Thomas of Florida National News. This question is for Dr. Pino really quickly. I just wanted to clarify something. Earlier you mentioned that the shots will be available for free for the students to get them at their schools, but you did also mention that parents could get them through their providers, given if they have insurance. So I just wanted to clarify, if a parent does it through their provider and not through a school, they would have to pay for it? Is that essentially what you're saying?
No one can charge for the vaccine. The vaccine is property of the federal government and was paid for the federal government. People can charge administration fee to the insurance company if the individual have insurance company, or some people may decide to pay that fee if the provider assess that fee to an individual. In our case, our distribution is absolutely free.
This is Nikki Zizaza with News 6. My question's for Dr. Pino. Dr. Pino, as the rollout is happening here for children 5 to 11, and with the positivity rate so low here in Orange County, you're still encouraging parents to get their children vaccinated, and you're hoping that that happens at least within the school district. But how are you guys anticipating how many parents are going to allow for their children to get vaccinated, especially with things looking the way they are? I mean, there's going to be a huge supply, and it's hard to gauge exactly how many people are going to get the vaccine.
We are calculating that our county in statistics has about 120, a little bit over 126,000 individuals in that age group. I believe it's 126,826, but I'm not 100% sure about the other half, but it's 126,000. So with that, you could assume that in the first phase, you will get to 50%, similar to what happened with adults, maybe a little bit lower, but around 80,000 kids is what we expected to be vaccinated in that age group. The challenge is going to be, and we want parents to be mindful of where they are taking their child to get vaccinated. That's also a choice. In the sense that some kids, if they were like me, you need like 3 people to hold you to get a vaccine. So you have to know your child, and you have to know which is the best environment to take your child to get vaccinated. A child like that should not go through a drive-through event. It should be more in a private setting when you can control the child. A drive-through event is for older children who behave properly for the vaccine, because it's a lot of movement through a window, and you don't want to have an accident of any kind happening. So with that, what we are advising people is also not only to get vaccinated for COVID-19, this is an opportunity, if you come to us and other providers, to get all the other vaccines that your child may be behind, or at least get a certification of where you are in your vaccines. Because of the pandemic, we have seen a reduction of immunization rate in other childhood immunizations that are also critically important to maintain the level of immunity that we have achieved.
Mayor Ryan Gillespie at the Orlando Sentinel. I know you said this last regular briefing for us today. Given where we are with numbers and with that decision, should the public kind of take this as like a declaring victory of sorts, or should there be any grand takeaway from people about where we stand now in the context of that decision?
I don't think we should declare victory, absolutely not, until we get to the point where there are 0 transmissions in our county. We should continue to make certain that we're doing all of those things that Dr. Pino just talked about to help keep ourselves, our children, our co-workers and employees, our neighbors safe.
This last question comes in for Dr. Pino from Ryan Lynch in the Orlando Business Journal. It reads, Dr. Pino, how do you expect the OSHA vaccine mandate for private employers to impact local vaccination rates?
So it will increase vaccination rates, I think. Although our vaccination rates are quite good. It could be that some specific branches of the economy are doing better than others with regard to vaccinations. Mandates always increase vaccination rates, and that was the question. It's different if you agree or disagree with mandate, but the reality is that they increase vaccination rates.
All right, so as we conclude this press briefing today, I just want to also say to Dr. Pino and the Florida Department of Health in Orange County, thank you for the wonderful partnership. While we will not have regular briefings, it does not mean that the collaboration ends today. We, in fact, will continue to work with the Department of Health. Been a great partnership with our school district as well. As you all know, there have been times when we have worked with the schools to provide vaccination opportunities, testing opportunities. So to the entire school board and to Dr. Jenkins, please convey my appreciation to them for the work that they have done with us for these last 19 months as well. And to all of you, the media, that have saw fit to attend these briefings on a regular basis. We do appreciate your efforts to help us communicate effectively to our community over time. If things change, we will regroup and we will continue to make certain that our community remains informed. And so with that, I do want to just also share with you that there will be another vaccine opportunity for children. The Florida Kids and Family Expo will be taking place at the Orange County Convention Center November the 13th and 14th. They've partnered with Walgreens to offer all attendees children's vaccinations. It is open to the public, but a ticket must be purchased for the expo to get the vaccine. Again, this is not an Orange County government-sponsored event. This is an event that is being sponsored by the Florida Kids and Family Expo. With that, thank you all for being here today. We hope you have a great weekend and a happy Diwali to everyone. This concludes the press briefing.